Hello, everyone. My name is Hilton Silva, and I'm very happy to be part of the Bioanthropological Talks 2021. Today, we'll be talking about our experience with some Brazilian Afro-derived populations called Quilombolas in relation to the social determinants of health and the impacts of racism and colonialism. So allow me to share my screen with you. The title of our work is Colonialism, Structural Racism, and Social Determinants of Health in Quilombola Communities of the Brazilian Amazon. This is a joint work with Dr. Lígia, Dr. Ariana Silva, Masters Roseane Oliveira, and Dr. Edson Ramos, and myself, Hilton Silva. We are from several institutions in Pará, from the University of Pará, from the State University of Pará, and from the Secretary of Education of Pará. And I'm also a member of the Center for Investigation in Health of the University of Coimbra. In Brazil, social inequality is one of the consequences of colonialism, particularly in the Amazon region, which was the last region of the country colonized by the European. In order to understand the effects of inequality, we have investigated the epidemiology of chronic and infectious diseases among children and adults from 6 Quilombola communities in the state of Pará, representative of many ecological areas of the state. In a series of studies carried out between 2008 and 2015, using the social determinants of health theory. But what are Quilombolas? For those of you which are not familiar with these groups, the term Quilombo was first used by Portuguese colonizers to describe both a physical community and a resistance movement against the slavery system in colonial Brazil. These communities, which were as small as 6 to 10 people, as large as over 2,000 or 3,000 people before the abolition of slavery in Brazil, were formed by Black enslaved who run away from farms and plantations and form parallel centers of power, production, and social organization. To this day, their descendants, called Quilombolas, continue to hold opposition to the oppressive and racist practices against the Brazilian Black population. Quilombos currently are present in all regions of the country, especially in the rural areas, and still they maintain some degree of geographic isolation in relation to the surrounding communities. There are over 5,000 Quilombola settlements in the country, encompassing several million people. However, the real number is unknown, as most areas are not officially recognized by the government, and there's never been a census of these groups. The process of slavery in the Americas, and particularly in Brazil, started around 1540 and lasted until 1888, when the Brazilian government abolished formally slavery. According to historians, during this period of over 300 years, more than 10 million individuals were enslaved in Africa and brought to the Americas, most of them to Brazil and to the United States. And approximately 75% of them perished along the journey. In relation to our samples, our projects were approved by the Institutional Committee of Ethics and Research of the Federal University of Pará and also by the involved communities who were all consulted previously to the start of the studies. All participants signed a research consent form following the resolution of the ethics in research with human subjects in Brazil, both the 196 of 1996 and the 466 of 2012. A total of 975 individuals from 6 communities participated in these studies. 52% of these were women and 36% were younger than 18 years of age. Pará is the second largest state in Brazil, and the areas for the study were chosen amongst the ones who had the highest density of Quilombola communities. Pará is the state, the 4th state in number of Quilombola communities in the country, behind Bahia, Maranhão, and Minas Gerais. Besides conducting research, our work also provided healthcare to the populations engaged in our project, according to provisions made with the local health system and also the local health system of the community. Overall, among the adults, 34% of the women and 32% of the men who were considered overweight, 24.8% of the women between 18 and 59 years of age, and 31.7% of the men over 60 years old were obese, and hypertension affected over 20% of the women and over 11% of the men, indicating that these groups suffer intensely with chronic diseases. When COVID-19 arrived in Brazil in 2020, the Quilombola communities were very heavily hit with the virus, because many of the individuals, especially the elderly, were already suffering, as we have seen before, with hypertension, obesity, and diabetes and other chronic diseases, which are preconditions to the worsening of COVID-19. And the result of that is that among the Quilombola communities in Brazil, the mortality rate is between 2 to 4 times higher than among the general population. Unfortunately, most of these information has not come from official sources, because the health system in Brazil does not collect data in relation to this particular ethnic group. So what happens is that all the information available in relation to the health of the Quilombola originates from their own organizations, and that's the only data that we have available so far. Among the children, 32.8% present some level of malnutrition, and also they are often affected by respiratory and skin infections and parasitic diseases. Additionally, it is common for them to present high levels of cavities since their deciduous dentition, which compromises the permanent dentition and the overall health. As we all know, cavities can, beyond affecting the capacity for chewing and absorbing nutrients, they can also have systemic effects, such as infections in the gut, and also heart conditions and liver conditions and other conditions that are related to the bacteria present in the cavities. All children that participated in the study had their parents previously consent to their participation. Regarding the social determinants of health, 81% of the Quilombolas do not have a bathroom in their houses. 72.3% of the sewage destination of the houses is to black pits, simply a hole in the ground near the house. 50.1% of the households earn less than one minimum wage per month, which is approximately €200. 69.1% need government financial support to survive throughout the month, and only 6.7% of the adults interviewed completed beyond elementary school. The housing situation of the Quilombola is often precarious and is associated with a series of diseases related to especially intestinal parasites and diseases associated with poor housing conditions. They also have difficulty being isolated during the pandemic and keeping social distance. So overall, the residents of the Quilombo areas in the Amazon basin lack access to health services, to potable drinking water, to basic sanitation, to education, to adequate housing, and often experience food insecurity. This is the case also for most other Quilombola communities investigated throughout Brazil. The history of Brazil has been built on the basis of social inequality, placing the Black population among the poorest and most socioeconomically vulnerable, whether these populations live in the cities, in the slums, or in the rural areas in the Quilombos. The situation results from the structural racism continually present in the country well into the 21st century, even though some public authorities insist in denying the existence of racism in Brazil. Among the difficulty of the Quilombola communities to access healthcare are lack of economic resources, the distance that they live from the areas, and also in more recent times, the fact that many of them, especially the elderly, have been impacted by COVID-19, and even when they have access to the health services, they still die at a higher rate than the other populations because of the previously existing conditions. In conclusion, cultural colonialism and structural racism are pervasive in Brazil, as I mentioned before, even though some authorities still insist in denying it. The impacts of racism in the country are evident in all the indicators of health. These reinforce the negative stereotypes against the Black population and other minorities, undermining the implementation of public policies to eliminate these social inequalities. So even though there are policies that were designed to improve the health of the Black population, these are not adequately applied. In order to change this situation, it is necessary that the Brazilian society recognizes and condemns racism and colonialist ideas in all its forms. As we are approaching the 20th anniversary of the World Conference Against All Forms of Racism and Discrimination that happened in Durban in South Africa in 2001, and as we approach the end of the decade of the Afro-descendants of the United Nations, it is important to remember that racism still plays a very strong role in the life of many people. Fortunately, there are organizations like CONAC, which is the National Association of the Quilombola Communities, and the Malungo, which is the Pará State Association of Quilombola Communities, which have fought every day to provide the communities with all the basic needs in terms of trying to survive the pandemic, and that have continue to resist racism and fight against all forms of racism and discrimination. It is time that everyone in the country join this fight, and that we condemn all forms of racism and discrimination in Brazil. Thank you.